Hi, hello. My name's Michael Nash. I'm a lecturer in psychiatric nursing at Trinity College in Dublin, and along with a colleague from Spain, Alonso Perez, who works at the hospital clinic in Barcelona, we conducted a study exploring Spanish mental health nurses' experiences of using mechanical restraint in practice. So this presentation is under the strand of activism and social justice. So in case, what is mechanical restraint? In case people are not aware or haven't witnessed it, mechanical restraint is the process of restraining someone who is in severe acute behavioural disturbance to a bed. So in this photograph here, typically what we see is a bed that's equipped with a belt that's attached around the waist, and then anklets and wristlets that may be sheepskin lined to prevent chafing of the extremities. So it's an intervention that's extremely controversial and one that provokes really strong negative emotional responses in both service users and staff that have to participate in it. Although rarely used in the United Kingdom, the recent NHS mental health bulletin did state that between 2016 and 2017, there were 1,200 occurrences of mechanical restraint in mental health services in England. So what did we do in our study? So this is just an outline of the study and the process. So we used a qualitative descriptive methodology for our investigation, and that involved a sample of 10 mental health nurses who were experienced in using mechanical restraint. And we had a 12-item interview schedule. And so these are examples of the questions that were asked. So how do you feel following the use of mechanical restraint? How do you think the patient feels when it's used? And how does the use of mechanical restraint affect a therapeutic nurse-patient relationship? So there were 12 questions, and these are just examples of some of the ones that were asked. So in our analysis, we used the thematic analysis of Braun and Clark. And when we were going through the data, these are the things that came out. So we had the major theme would be symmetrical trauma. And that symmetrical trauma, we try to characterize that or represent it as a scale of prejudicial effects, both on the nurse and the service user. Our second major theme was that of moral injury. And the third theme was broken trust. So just to look at the themes in order. So when we asked the participants how they felt following the use of mechanical restraint, this is the way we have interpreted what they've said. So they use terms such as feeling bad or feeling impotent, up to feeling totally traumatized. So then when we asked the participants how do they think the service user felt, the terms that they were using were symmetrical to what they had felt themselves. So they felt that the service user felt bad, and they felt impotent and very distressed and totally traumatized as well. So we just try to characterize that using this scale of prejudicial effects, because it affected both the nurses and the service users similarly. Our second theme was that of moral injury. And simply put, a moral injury is a harm that's been done to someone's sense of values or their personal beliefs. And in Litz et al.'s definition, it includes factors such as perpetrating or witnessing acts that may transgress deeply held moral beliefs or expectations. And these could eventually prove to be harmful. So for us, we felt that for mental health nurses that were participating in mechanical restraint, that it dealt an injury to their sense of professional and ethical values of being a nurse whose primary goal is to provide care, but the use of mechanical restraint seemed to go against all of that there, where there was where it necessitated an extremely paternalistic and controlling approach towards the interaction with service users. So these are a selection of some of the quotes, and you can see that some of the terms that are used there would denote some type of injury to the idea that people had of themselves as carers, professional carers. So there was a powerlessness, a dejection, and a frustration. They felt that in order to lessen the effect of their injury, that they had to desensitize themselves to the use of the intervention. And it did provoke a very, very big ethical dilemma. People didn't like using the intervention. And then what the result of the intervention in terms of the effect that it had on the nurse-patient relationship, well, it's unsurprising that the respondents reported that it had extremely negative impacts on the nurse-patient relationship, and the thing that suffered most was trust. So trust seemed to be broken. We didn't get the sense that it was irreparably broken, but it did receive quite a significant trauma in terms of how the nurses and the service users were interacting following the use of mechanical restraint, so that people found that there was a distance between them and the service user. There was a diminishing in the trust. Sometimes the therapeutic alliance was totally broken, and then had a process of rebuilding that had to be undertaken again. So trust really was broken. So for us, what did we find were the implications for mental health nursing practice? Well, the use of restrictive practices of whatever type are controversial, and while being legal and mandated in either the Mental Health Act, it doesn't make it any more palatable for people when they have to use them. So in that regard, what we found was that the manifestation of the harms that are caused when people have to use restrictive practices are quite symmetrical. We also thought that moral injury is something that's quite significant, that if we're using these restrictive practices or restrictive interventions, that we need to consider moral injury a bit more seriously when it comes to supporting mental health nurses and other professionals when they're working with controversial interventions. And that would include the service user and their families and carers as well. And then obviously there is the restoration of trust with service users when they have to undergo restrictive practices remains an ongoing challenge for mental health nursing practice. So thank you.